What do Senate Republicans do next? That's the question after it turned out that the highly anticipated vote on the Senate's version of repealing and replacing Obamacare won't happen by the promised July 4th deadline as the GOP struggles to find the support to pass it. But Senate Majority Leader Mitch McConnell pointed out that major actions like this are difficult.
If none of you have ever covered a big, complicated bill, they're hard to pull together and hard to pass.
Republican lawmakers have campaigned for years on repealing Obamacare, but now that they have the opportunity, they're having to work hard to agree on what to replace it with. McConnell says the process is far from over.
We're continuing to talk about it. It's a very complicated subject. I remember how challenging it was for the Democrats when they were enacting this back in 2009 and 2010. It's a big, complicated subject. We've got a lot of discussions going on, and we're still optimistic we're going to get there.
Leader McConnell is running into the same issue the House faced last spring, crafting a health care plan that both conservative and moderates support. Senator Rand Paul is one of the GOP senators on the conservative side who opposed the bill as it stands now. He told CBN News he met with President Trump this week, who he says is open to negotiating the bill, but he hasn't heard from Senate leadership.
If we can make the bill more of a repeal bill, I think I could get to the point where I could support it. Right now, I think we keep too many of the Obamacare regulations, we keep too many of the Obamacare subsidies, and we have a brand new big federal bailout of insurance companies.
On the other side are moderates like Senator Susan Collins, who are concerned with Medicaid cuts and defunding Planned Parenthood.
It makes absolutely no sense to eliminate federal funding for Planned Parenthood.
Collins says she's optimistic she'll prevail on that issue, but Paul disagrees.
I don't think we should have any federal money going to pay for abortions. Now, they say they're not using it for abortion, but if they're using it to pay their electricity to perform abortions, I think it's the same thing as far as I'm concerned. Planned Parenthood doesn't do anything that community health centers also do other than abortion. So the bill actually gives more money for community health centers.
And Paul says if senators want to include expanding Medicaid to cover more people for health insurance, they need to be honest with people about how they're going to pay for it.
Everybody wants something, they think it's for free, and they don't want to pay any taxes to get it. So that's what we have to decide. I think if you want Medicaid expansion, there has to be an honest accounting of how we pay for it.
While Republicans say Obamacare is in a death spiral, Democrats argue it's failing because the future of the program is unclear under the Trump administration.
The insurance companies look to the future. They say, what's the future going to be? And within that, they then structure their policies and set their price. They have absolutely no idea what will happen. They can't set prices. They don't know if there's going to be a requirement for certain benefits or not. And so they're pulling out of the market because they cannot price their product, they cannot write a contract, and they say, we can't be here without some certainty.
But Republicans say Obamacare was collapsing before President Trump was elected, and that they have no choice but to replace it before things get even worse. President Trump is meeting with Republican senators to help gain support of the legislation, and says they really want to get it right. Senate leadership hopes that after negotiating and amending the bill, they'll get the votes they need soon. Reporting from Capitol Hill, Abigail Robertson, CBN News.